Hi, I'm Richard Sugarman. I am one of the emergency medicine physicians here at Seattle Children's, and I wanted to welcome you all to Pediatric Grand Rounds at Seattle Children's Hospital. This week, we are honored to have as our guest speaker Dr. Susan Pacheco. Dr. Pacheco comes to us where she is the professor of pediatrics in the Department of Allergy and Immunology at the University of Texas. She did her undergraduate and her medical school education at the University of Puerto Rico. And then she came to Baylor College of Medicine, where she did her pediatric residency. She completed her allergy and immunology fellowship, and then completed a fellowship in clinical laboratory immunology before moving on to the University of Texas. Dr. Pacheco is here to talk to us today on the topic of climate justice. And we're excited that she was recommended to us by one of our first year residents, Dr. Allie Perkins, who has been working hard on the issue of climate justice and found Dr. Pacheco as an esteemed speaker on this topic and asked that we see if we could bring her to Seattle. So Dr. Pacheco, we're thrilled to have you here. I'll say before we get started to everyone who's on the WebEx, please do us a favor, just a reminder to keep your audio muted during the presentation. You're welcome to have your camera on if you would like it to be on. And if you don't want to have your camera on, just remember to turn it off now. Dr. Pacheco, I'll turn it over to you, and then we'll stop at about 8:50 for questions and discussion.
Beautiful. Thank you so much. I was sharing with Dr. Sugarman that it's unreal that I am in Texas and you are up there in your beautiful state. But it's, I'm honored to be able to share this information. And let me start by saying that when my kids were adolescents, my oldest one, the one holding the little dachshund with the orange shirt, he had homework. As part of his homework, he was instructed to go and see the documentary An Inconvenient Truth, the Al Gore documentary, like some people know it. So, I was very reluctant for many reasons. One of them is that it's the middle of the week and school the next day, work the next day, but trying to be a good mother, at least that's what I told myself, okay, I'm going with my children. And I remember as I paid attention, sitting there saying, I was surprised and I was baffled by what was going on with the environment. And I told myself, you think that you're a good pediatrician, and you have not paid attention to the climate crisis. So I started working and I started searching, and it has taken me to the point where I'm at this point in my life, where besides my job, paid job at the University of Texas, everything that I do has to do with climate because we're running short on time. So having said that, of course, I'm a pediatrician, and of course, I am going to talk about children, but we'll talk about climate justice, and that is a concept that we're starting to think about lately. And in this talk, in these hours, I will share with you how pollution and heat are affecting birth outcomes and lives in general. I put there children's, but in reality, all individuals, including those in disenfranchised communities. So I don't have any disclosures. Okay, most of the information, some of the information that I'm going to share with you comes from the NCA National Climate Assessment Report published by the U.S. Global Change Research Program in 2018. But I also mentioned briefly the 2019 issue of the Lancet on Health and Climate Change, because it's dedicated to health in children. And well, let me go to the objectives because we're supposed to have objectives here. No, but so basically, how the climate is changing, how children are affected, the threat multipliers that we find in these populations, and what can we do? And that is very important because we can do a lot to help this crisis. So just as a review, because some of us may not remember, the continued use of fossil fuels increases greenhouse gases, which has increased the planet significantly. You have to your left, what are the outcomes? Sea level rise, extreme weather events, heat waves, fire, droughts, just to name a few. And very relevant to what we're going to do. So a secondary side effects is that the air quality is affected because all of these chemicals are released into the environment. Now, this is the quote that I have from the Lancet report, which I don't know, when I saw this, for me, it was pretty sobering because the world that children are inheriting is different than the world that we live here now. And, I think about this every day and I struggle and how we can create awareness. And that's why I welcome all of these opportunities, because one person that we get engaged is one person joining the battle. So the world is changing, and this is not wanting to change with me. Okay. Now, in spite of, we've had all of these bursts of things about climate change. Everybody's talking about climate change. We have the Fridays for Youth. We have COVID. We have, there's a new administration now that is paying attention or will pay attention to this, but we are moving in the wrong direction, because in spite of all of the things and people coming together, the surface temperature of 2020 tied with 2016 as the warmest years on record. And that is very concerning because we are nowhere close to what the Paris Agreement recommends that we do if we want to avoid catastrophe. Now, climate justice, we pediatricians, we're healthcare providers, we take care of people. So in the context of what we do, and as we work with climate change, we need to be aware that different groups will be affected in different ways. And we need to provide to those populations that, if you think about it, they don't have the means, many times not only to adapt, but to be proactive, to engage in initiatives for or against the climate, because they have a series of problems. And I'm sure that those of you that are in academia and even in the community see how our patients struggle. So it is our call to do something different. Now, this is when I saw this slide, just talks about injustice. On the top panel, this is 50 years of carbon emissions. And we know it, the people that produce the most are the ones that are going to be affected the least. So you see the top panel as CO2 carbon emissions. And in the bottom panel is a mortality from climate sensitive conditions in the world. And you can see the difference. Many people don't know that cumulative production of CO2, the leader in the world since the beginning of the Industrial Revolution is the United States. And I put some numbers there because I think that is interesting. Yeah, USA is 25% of total emissions since this nightmare started 2 centuries ago. The EU is 22%, but EU is comprised of 27 countries now. China, it's 12.7% of total emissions. India, 3%, Africa and South America 3%. So, you know, we're responsible. We're responsible, and I think that is our duty to do something about this and to take the leadership for many reasons. Okay, so very briefly, I will mention here that we see increase in CO2 levels. What happens? Temperatures go up. We have more extreme weather events. We have rising sea levels, and that's what you see in the middle circle. And then you have all of these outcomes: um, severe weather, extreme heat, environmental degradation, water quality impacts, allergens. But I want to bring to our attention today air pollution and heat exposure, because they really have an impact in our populations. So, social determinants of health are the ones that affect the vulnerability of our individuals. And you know, it's not very difficult for us in the health field to know that there's differential exposure and, and then differential sensitivity, for example, ages or chronic illness, or and differential adaptive capacity. And that's on your left panel. So what's going to happen? That will give us a different set of exposure pathways and health impacts depending on the population. Like, I know that I will not suffer from the effects of extreme heat because I am a professional who has a decent life. I know I have the benefit of knowledge that most of our populations don't have, and I know what to do. And that's a very important point, because something that we can start doing today is empowering those patients and families that we take care of, so that they too, even if they cannot get that engaged in mitigation practices or advocacy, they can protect themselves and their children. So let me go real quick on the risks from air pollution, and this is from the NCA 2016. And you know, it's not very difficult that if we don't do anything, climate change will continue worsening air pollution. And I have the second paragraph there because most of us think, when they say air pollution, what do we think about? Well, we think about allergies, asthma, cardiovascular disease, maybe stroke, but and premature death in these vulnerable populations, not in the pediatric populations. However, there's much more to air pollution than cardiovascular disease, and that's what I want to share with you today. Now, this is very complicated because we know that ground level ozone is one of the pollutants that affects respiratory health at many levels, and we know that ozone increases as the temperature increases. In the last American Lung Association State of the Art report, we improve in some areas in particulate matter, but many areas in ground level ozone increase. And what is thought the reason for this is because of the temperature increases that facilitate the production of ozone. Now, the same pollution and heat exposure, we know that if things don't change, climate change will increase the ozone levels over most of the US and, of course, the world. And this will see more in very polluted areas. Forest fires, and I know that your state has been plagued by the outcomes of forest fires among with many states in the nation and across the world, and that is expected to increase. Wildfires is going to affect air quality. And again, I'm sure you recognize this place, and I know that you have witnessed this. Now, what happens? Let's talk about children, and let's talk about what will we see. We know that we're going to have increasing temperatures. The temperatures are going to increase. In this, over the next few decades, if we continue the way we are, it's going to be 2.5 degrees, on average, 2.5 degrees Fahrenheit higher. And by the end of the century, anything between 3 to 12 degrees Fahrenheit. And you can see how the emissions, what the temperatures will be. On the right is the world, on the left is the US, and this is mid 21st century, and this is late 21st century. The urban heat islands will continue to increase, and you know, urban heat islands are these urban places where the temperature is higher in the urban area compared to suburban or rural areas. And I know that you guys experienced that. The map on the right is mapping of urban heat areas around the world. But Seattle has not been immune to this, and there's recent data that there can be a 17-degree differential of temperatures between the city and nearby rural areas, with an average of 4.1 degrees in the summer. I got another report where there was the temperature differential was 23 degrees for your city. So it's very concerning. Now, why is this important, and does it matter? Well, I hope I can convince you that it does. Now, when we think about air pollution, all of us think about asthma, right? And we know that in spite of the national air quality standards that are in place by the EPA, individuals get sick. We have that there's decrease in pulmonary functional capacity. We know that air pollution increases the new diagnosis and prevalence of asthma, even in individuals that don't have a history of atopic disease, and also emergency room visits and hospitalizations. However, I need to share with you that there's more to air pollution than asthma, and that the effects of air pollution, the detrimental effects of air pollution, start very early. And I know that the most of the ladies of reproductive age in the US, and of course the world, are not aware of this, so they don't have any way to protect their babies. This is changing because of some ongoing legislation, some work that we've been doing, but it's something that most people are not aware of. And it's sobering because, you know, the pollution goes through the mother, creates an inflammatory response that crosses the placenta and affects the baby at many levels. But not only that, but air pollution can induce epigenetic changes. And we're starting to see these changes that are going to alter who these kids are, may alter who these kids are, because these changes will be transmitted for generations. So the other thing that we need to be aware is that when the mothers are exposed to air pollution, and here is an example with NO2, you can, depending on the trimester of exposure, you can have increased eczema, second trimester asthma, and third trimester allergic rhinitis. And if you look at the odd ratios that are there, you know, they're pretty significant. So this is not a soft association. And in my practice, I see this all the time, because I'm starting to see parents who say, but Dr. Pacheco, we don't have allergens in the house, we don't smoke, you know, there's no history of atopic disease in the family, but we don't talk about air pollution, we don't talk about exposure of the mothers, and even exposure of the child as he or she grows is going to continue to have this inflammatory process. Now we know, and we published this recently in a JAMA article with other people, that exposure to these particulates and pollutants can have adverse birth outcomes, including prematurity, low birth weight, SGAs and stillbirth. Now, we know as pediatricians that just having those conditions may affect the future development of the child. So these kids already come with a hit. Temperature elevations, the same, and this is some data that we publish in the same study. We have increased negative birth outcomes that is worse in minority populations for prematurity and low birth weight. And this was in a group of, we look at about 32 million births. Air pollution is associated with leukemia, prenatal and postnatal exposure. There's a lot of data that comes from California when it comes to the US. Now, this is very sobering, and I guess I can say that it's one of the reasons why I want to talk about climate change, because children's brains are being affected. And this is something that we're starting to see and we're starting to recognize more. Dr. Calderon Garcidueñas was described this a couple of decades ago, I want to say. However, we're becoming more aware that kids exposed to air pollution, and some of the initial data came from Mexico City, they have neuroinflammation, which is not surprising, right? And that can go through hypothesis is through the cribriform form for a plate or airway inflammation that just seeps for the whole body. And those kids can have cognitive deficits. There can be neurodegeneration, structural and volumetric changes. But even more concerning is that there can be tissue changes in the brain that we see in pre-Alzheimer's and pre-Parkinson's. So if this doesn't worry you, I don't know, because I agonize over this. And that's why I am so involved in activities that have to do with air quality. Infections increase with exposure to air pollution, pneumonia, ear infections, and airway infections. And that's primarily, there's very strong data with that showing that coming from China. Now, it's not only airway problems and brain problems, but we know that exposure to air pollution seems to favor the development of parameters that reveal abnormal glucose metabolism and increased risk for type 2 diabetes. This is seen in the pediatric population, and it's also seen in the adult population. And I know that you're aware that Los Angeles has been top in the country for years in a degree of air pollution. So the population of children that are exposed to air pollution, and that also for many reasons, their urban life are obese, are at higher risk of having these problems. This has been described, renal disease in patients after exposure to air pollution. Very strong data from the US veterans cohort, very, very strong data. And I think that is an issue of time before we see this in the pediatric population. We're seeing it in adults now, but I'm sure that it will come for pediatrics. Now, heat, temperature elevations, I said that the changes that we're going to see, higher morbidity and mortality for children ages 0 to 4, higher mortality for older populations. Now, I put that map of Europe on the right side of the panel because that is the map of Europe in 2003 when they had this severe summer heat wave, and there was an excess of 70,000 people that died during that summer in Europe. Most of them were adults or older adults. So, and with the climate changing, these heat waves are going to continue to increase, and we've had a good share in the US. Now, maternal heat exposure is also associated to the increase incidence of congenital heart disease. This is a population study published a couple of years ago. But follow-up study for the progression of heart disease in the setting of changing temperatures says that some states, depending on the degree of temperature increases, are going to be the ones that are going to have the highest burden of disease. And you can see the states there. So we need to educate mothers and to be careful with heat exposure. And it's very interesting. If you review these studies, it's not like these ladies were in the fields working for hours. These were relatively modest exposure to heat. Kidney stones, the same. We know that the kidney stone risk belt is increasing up as temperature increases. Now, there's this chronic kidney disease of unknown etiology that it seems that has been reported around the world for some years now. And there's data coming that suggests that it has to do with heat exposure. And these are vulnerable populations that are very affected because many of them are farm workers or outdoor workers. That is not only the heat, but they are dehydrated because drinking water in the middle of your duties is not a priority. And again, a matter of time before we see this in children. Now, by the numbers, I want you to put these conditions in the context of what you're going to see now. Because we have, in terms of live births, 140 million births per year. US is almost 4 billion. Women of reproductive age, 1.55 billion, US 62 million. Children, 2 billion. In the US, over 70 millions. Now, every day we have a bunch of babies that come to the planet, and they are experiencing what I am talking about, and many other things. So the damage starts then. Now, 90% of the population of children in the world are exposed to air pollution. 90%. And if you put in context all of the things that I shared with you before, you can see how at a multisystemic levels, these kids are getting affected. And of course, the burden of disease falls in the poorest countries. Okay, let's come to the US. This is data from the American Lung Association State of the Air Report 2020, but they look at data from 2016 to 2018. And that's where I saw that ozone parameters were increased. We had some improvement in particulate matter, but however, in spite of the improvements, nearly 5 in 10 people in the US, and that translates to 150 million individuals, live in counties with poor quality. Now let's look at the graph, the table on the right, because they give Fs in this classification if you fail one of the parameters on the left, and 3 Fs if you fail all 3 of them. So we know that people in the poverty are exposed. 18.7 million of them were living in areas that receive 1F, and 3 million in areas that receive 3 Fs. Communities of colors, 74 million living in counties that receive 1F, over 14 million living in counties that receive 1F. And children, we go to children, 1F, 34.2 million, 3Fs, 5 million. So we have this large population of children that are being exposed to air pollution every day. This is aggravated by is aggravated and will continue to be aggravated by exposure to air pollution. And you can see how children are affected by exposure. And it's not only exposure, but it's disruption of their life routines. Now, heat, many people don't know this. We have about 3 million farm workers in the US. Great. However, there are close to 500,000 children ages 12 to 17 that are working in U.S. agriculture. And what is very interesting is that these children don't have any type of protection. And basically, it's the decision of the parents if they are going to work or are not going to work. But with the data that we have, this is the number that we have, and the kids are getting exposed not only to the threats of working with machinery and equipment and whatever, but they're getting exposed to heat, air pollution, not to talk about the mental issues that all of these things can bring. So, inequalities. We know that climate change, I guess I've touched very briefly how climate change brings inequalities to people. Now, I want to share with you some maps of the US because, there's some trends here. You see, if you look at in the right, where the minorities are living, Hispanics are green, two or more minorities is lighter green, blacks is orange. So if you see the distribution of minorities, it's pretty significant that that's also where we find more poverty in the US. Now, why is this relevant? And it's because, in general, many of those communities are the ones that they are getting warmer and will get warmer as time goes on. And it's not that difficult to imagine that, because many of these states and many of these counties and communities include urban populations. So the life is different there, and we have this heat island effect that is going to affect them. So it doesn't take much to know that where people are congregated is where these things are going to happen. Air pollution, pretty much a similar distribution than what you saw in the other slides. Now, it's not even exposure, but we know that the inequality in the economy increases with different aspects of climate change, and the populations are affected differentially. And again, we go back to the same pattern. So I talk about climate justice, and the terms these are kind of new terms. We have climate justice. Some people talk about environmental justice. But it's what we need to ask ourselves: how do we, you in Seattle, Dr. Pacheco here in her nice office with air conditioning, how do we bring meaning to the life of individuals? How do we protect them? How do we take into consideration that because of their age, because of their national origin, because of their access to care or lack of access to care, because of their ethnicity, because of poverty, they will be affected the most. And we don't have the same degree of protection for our communities, and it keeps happening. So we need to reflect on how we're going to make this happen. This report is published today, was released today by WeCan. And I read the report, and it's very interesting because it's, you can read it there, Gender and Racial Impacts of Fossil Fuel Industry in North America and Complicit Financial Institutions. And I just put this document on the right because it caught my attention how these Imperial and Shell and ESSO, they knew 50 years ago that all of these things were affecting health. But then it's very interesting because they then engage in minimizing these exposures and these findings, and created a concerted campaign to minimize that this was happening. But these are internal medicines that WeCan is publishing, and they talk about that. And you know, the report also go about indigenous populations that, for example, are not taken into consideration when all of these developments are going to be made that go through their lands. Nobody asks them for permission. We don't care, right? So it's a very, very eye-opening and very moving report that I would encourage you to take a look at. Now, let's go to the vulnerable populations. We know that there's disparities in distribution of particulate matter by race and poverty status. And this looked at counties in the US, and we know that people living in poverty, non-whites, and blacks had differential exposures. For people living in poverty, was 1.3 times higher burden of exposure than the overall population. Blacks had 1.54 times higher. Non-whites overall was 1.28. So there's differential exposure. Now, asthma death rates, we know this, highest among blacks and greater for females. And it's very interesting because the deposition of particulate matter in the lungs of females has different mechanics than lungs of males. So women may be affected different for many reasons, but that may be one of them. But as you can see here, black populations, the asthma death rates are higher than any other group. In general, asthma in children, this is in the US. You can see the prevalence is higher in non-Hispanic black compared to non-Hispanic white. And the hospital admissions rate per 1,000 cases are higher in non-Hispanic black compared to non-Hispanic whites. And you see, of course, that you have a higher ratio when you do the math. So children, adults are being affected in a different way. Heat is a different story, or no, it's a different story with the same pattern, because this was a very interesting study. Great number of counties were looked in the US. And what was noticed was that in places where there were more Black residents and Hispanic residents, there was a higher number of days with temperatures above 100 degrees Fahrenheit between 1971 and 2000. And for if the county had over 25% Black residents, was 18 days per year. Counties with over 25% Hispanic, 13 days. Less than 25 African Americans, 7 days per year. Now, this is 1971 to 2000. I can guarantee you that the disparity is much higher now. Now, I have to admit that I did not know much about redlining until I started doing research about social inequalities. Maybe because I was not born in Texas. But, you know, there was a practice in the 1930s by the American Homeowners Association, and that was imposed by the federal government in an effort to move away from the recession, where some areas in the states were redlined, and meaning that they were set as undesirable for developing communities of white people and providing loans. So the segregation was established that way. So the study looks at, I think it's 108, I'm sorry, urban areas, and of them, 94% of all of these displayed patterns of elevated land surface temperature compared to not redline areas. And the difference could be as high as 7 degrees. And that is I don't know. I don't know what to say, but we need to pay attention to this, and we need to be advocates of the populations that are affected the most. Now, Cancer Alley, I live in Louisiana 3 years, so I'm familiar with Cancer Alley. For those of you that are not, this is 85 miles between Baton Rouge and New Orleans. And there are around, it says 136, but around 150 petrochemical plants and oil refineries. So, and it produces 1/4 of the nation's petrochemicals. Why is this relevant? Well, it's relevant because the mortality rate in Louisiana is higher than the mortality in that the national average has. And the mortality is even more significant when you look at African American individuals compared to the national average. So the populations that are living there and not getting affected differentially, the impact of this is such that a few weeks ago, I think this is March of 2021, United Nations Human Rights Group says that environmental racism in Louisiana Cancer Alley had to stop. And unfortunately, and there's a lot of anger, and there's a lot of community activities trying to halt, but the petrochemicals and all of the refineries, they tend to be oblivious to what people are saying. Now, one thing that you need to be aware of is that many of the communities, and there's an example in the We Can report, many of the communities, they fight, but they don't have the same impact. There's a group in a community in Colorado some years ago that Formosa, they wanted to bring some petrochemicals in this district, close to this district where most of the kids were white. Long story short, there was a big community of growers, lawyers, everything, and they stopped. A year goes by, and they go to this district where the kids are mainly minorities. Community uproar, lawsuits maybe, but the project developed in spite of what the community said. And even worse, they put this, they decreased the space between the construction of the sites and the school systems. But many of these communities, they don't have the resources to fight. Now, COVID and air pollution, I'm sure that you've heard this, and there's data coming from all over the world. I just put a few there, very reliable data that says that mortality of COVID increases in areas of air pollution. And if you have all of these minorities and all of these poor people and all of these individuals with limited access to care, it's not difficult to imagine that they're going to be affected differently. At the world level, 50% contribution for hazardous air pollutants, 9% increase in COVID mortality, particulate matter. This is difficult to imagine. For 1 microgram per square millimeters in long-term average exposure to PM.5, mortality increased by 11%. And the same data is coming about long-term exposure of nitrous dioxide. So what do we do? What do we do? And many of us are doing, but we're not doing enough. Many of assuming that there's young people in the audience that are training. I want you to think about this because we are instruments of health. We are instruments of hope. We are instruments of education. We are instruments of advocacy. And we can intervene and we can do many things to protect our populations. So let's spend a few minutes here. You know, I always joke with become, this is the what can you do? And I'll spend a few minutes here because I think that is very important. I always put there become that person. And what this means is, you know, let me give you my example. If anything comes to the University of Texas about climate change, somebody, a reporter, news person, they have a question, whatever, everyone says, oh yeah, go to Dr. Pacheco because she knows about climate. So if we become that person, we are able to provide help at many levels. Um, now, we need to engage our communities in climate-related activities, but let me go to the right side because we need to speak up. Children are speaking up, adolescents are speaking up, mothers are speaking up, the health professional is speaking up, and you know what? It's still not enough. We need to educate ourselves because I'm sure that some of the things that I presented here comes as a surprise to some of you. Um, we need to educate ourselves, but we also need to educate our community. You know, I have a campaign going now with education at many levels, but education of mothers. And I think, and I'm starting to know that if the mothers knew what is happening to their babies, we would be having a different conversation about climate change. The same way that the Mothers Against Drunk Drivers started, it was just one mother whose child died with a drunk driver. So we're trying to mobilize mothers and let them know, because most people are not aware that climate change is so detrimental to health. Um, Build community to promote resilience, you know, and that's something, if you think about the, you know, we talk about a lot of these exposures as adverse childhood events, even though it's not in the original classification, but we can use the same principles that we use to help those kids when we have uh, adverse childhood experiences, when we have extreme weather events, or we have displacement, or we have fires. Uh, we need to identify populations at risk and educate them about adaptation. Again, because, you know, this is what I tell my residents, the mother that has to borrow money to come to the medical center, take a bus to come to the medical center, is not going to be that concerned, or she has her hands full. So it's our job to help them. Now, there's many ways to reduce our carbon footprint. And in our home, and I was telling a colleague of mine that I've just put solar panels in my home. Took me a while, but and 80% of my energy is going to be solar, and it's baffling. But you know, we can do that in our offices, in the medical school, in the hospitals, everywhere. The university here just put sensors, for motion sensors, so when you leave the room, the lights go down. So there's many things that we can do that are not that difficult and are going to make a difference. We can include air pollution and heat exposure in risk in prenatal and anticipatory guidance visits. Renewable energy, you can change to renewable energy. Just check who are you buying energy from, and if you have sources of renewable energy in your state, which I know you do, just change because it'll make a difference and it'll help the renewable energy industry change. Reduce waste. You know, this is, if you start thinking about the amount of waste we produce with buying soft drinks every day or buying plastic goods every day, or, you know, it's unreal. And I invite you, if you haven't seen, to explore what's happening with the plastics in the world, because they are ending in places where they should not. So decreasing consumption helps. And I put here plant trees. And this is the thing. It's very interesting. We say, well, it is there's clear data that even from Seattle, that communities where there are trees are the urban heat island effect is not as high as it is in other places. So yes, we talk about CO2 and let's plant trees and whatever, but it also provides a shelter for the population, and it beautifies the population, which is good for mental health and development. So, let's go and plant trees. Just join those campaigns because we can make a difference that way. Those of you that have the time and the will, let's advocate. Let's go out and say this is wrong. Write letters, join groups. The American Academy of Pediatrics is very active about this. So join the academy. Just inquire, and we'll be very happy to help you or point you in the direction that you can go. So it's 50 minutes, 17 seconds, and I respect your time. I really appreciate the opportunity to be with you, and I think we have a few minutes for questions.
Dr. Pacheco, thank you.
Yes.
Thank you so much for that sobering overview of the crisis that we face across the world. We really appreciate you being here today to talk with us about it. I'd like to open up the chat box to questions for Dr. Pacheco. You can also unmute and ask a question. And as we're waiting for our questions to come in, Dr. Pacheco, I just wanted to ask you, I know when we talked earlier, you mentioned that you were involved with the American Academy of Pediatrics Council on Environmental Health.
Yes.
I was wondering if you could talk a little. I really appreciate that you gave us these things that we could all do as individuals to start thinking about how we can become that person and how we. Can you talk a little bit about the work that organizations like the AAP is doing to advocate for children's health around this environmental climate crisis?
Oh, no, and this is great because I joined the Council on Environmental Health 6 years ago. Right? I just finished, this past year. But when I joined the council, yes, we were doing air pollution. Yes, we were doing lead. We were doing all of these things that have to do with the environment. But we shifted gradually to the point that now, if it hasn't happened, it's going to happen because we're going to put climate change in the name of the council, at least up to a few months ago. And we are focusing our initiatives and many of the activities of the council to climate change. So the academy is the academy is changing, and what we say, the council, that if we don't pay attention to this, none of the other activities of the academy matter. Maybe it would matter now, but it won't matter in the future. So the academy is shifting. Now, let me say that there are, and you guys have it, with the academy, there's a 50 climate leaders, one per state, that was organized by Lori Byron, and it's a group from the academy. So I'm sure that there's a group for Washington. And if you don't know that person, I'll be happy to find the name with Lori, because that's that group, they're doing activities and policy and advocacy. So it's a very good way to reach out and meet people that are thinking the same way and trying to help children.
Great. Thank you so much. I think that really helps people to have a perspective of what our major advocacy group for pediatricians is doing on this important topic. Okay. And we'll turn to the chat and see if there are questions from anyone in the audience for Dr. Pacheco.
Hi, Dr. Pacheco. This is Dr. Molly Groh, one of the general pediatricians here.
Hello.
And very grateful for your wonderful talk and really important leadership and advocacy in this topic. I think I'm going to put in the chat one of the things that Allie Perkins is one of our interns this year in our residency program, and she and several other residents have been particularly active in this area and developed the Pediatricians for Climate Action for our state, and are working with our Washington chapter of the AAP, and we're all trying to support the ongoing efforts about that. And anybody who's on the call who's interested in this work is definitely invited to join us. One of the things that I struggle with is that I think there are two kind of reactions that people feel in this area. One is overwhelmed and kind of wanting to almost turn away from how difficult and big this problem is. And then I think the other is just kind of frustrated with the inability to move the needle. And I guess I would love to hear from you, what gives you hope to keep going at this, and how do you feel like we can do the best job at bringing people in to advocate on this really critical issue?
Oh, wow, that's a difficult question. But what gives me hope are the three youngsters that I presented at the beginning of the talk, which are my kids that now I blame for having me here. They're the responsible for having me here. No, but as a pediatrician, actually more than hope, motivation is our patients, the patients that we see every day, because this is oh my God, this child is at so much risk, and he or she doesn't know it. And, I won't be here. When the bad things continue to happen, I won't be here. But, the hope comes, and I've thought about this a lot. If you think about the last few years, people are coming together and saying that this is important. And even though, we're paying more attention to renewables, we're having more conversations of this type. Now we have a administration as in our government that is paying attention. So even though they're not humongous efforts and we are failing the Paris Agreement, people are coming together. And I have to tell myself, because otherwise I won't be here, that we have to make it happen. And I think we will. It's challenging, but that's why these conversations are so important, because I know that each one of the people that are listening here will have something, I just started giving one talks here and there, and now I'm giving so many talks. And just sharing, I can tell you, telling people what's happening and moving this away from politics helps a lot. And that's very challenging, but it can be done. So, and the other thing that gives me hope is people like Ali, and we have our share here in the medical school, students that are just, they saw the problem, and they are just active as they can. And if this is their world, we're doing it for them. But if they can do it, we can.
Thank you so much, Dr. Pacheco. Appreciate your message.
And Molly, thank you for putting that information in the chat there. There's a link to pedsforclimateaction.org that Molly referenced in the chat, and I'll certainly click on that link after this grand rounds and learn how I can become more involved. Dr. Pacheco, we're right up at the hour now, so I think we need to close, but we want to, again, thank you so much for taking the time to speak with us. And we hope to have you come personally to Seattle sometime to be able
to. That's the goal, right? That's the goal.
Yeah, that's the goal. Okay.
Beautiful. Thank you so much for having me. It's been a pleasure. Okay. Bye-bye.
And thanks everyone for attending Grand Rounds this morning. We'll see you next week.